Your health, brought to you by UC San Diego Health.
A big health story a lot of people talking about today. Major changes to protect young athletes. Soccer in particular. The U.S. Soccer Federation is banning kids from heading the ball. Several studies have linked concussions to headers, so kids under the age of 11 are not allowed to do it in practices or games. Those ages 11 to 13 can only head the ball during games. The new guidelines resolve a proposed class action lawsuit filed against U.S. Soccer and others last year. Soccer, a big thing here in San Diego. Lots of parents have kids who play soccer. So joining us to talk a little bit more about this story is Dr. Richard Chaffoo from Scripps. All right, Doc, great to have you.
Good to see you, Jan.
All right, talk to me about this thing with concussions. I feel like a lot of time when we think kids and concussions, or even adults and concussions for that matter, the first sport that pops into our head is football. This is soccer.
Correct. And actually the thing, Jen, I think the ruling was an excellent decision made because, you know, any kind of contact sports, we can see concussions. In fact, in the past 10 years, we've seen a doubling in concussions according to the American Academy of Pediatrics. The problem, Jen, is that during developmental years, during that younger age, as you mentioned, headers are when, of course, when the soccer player will hit the ball with his head. And the problem with these concussions is that there's traumatic brain injury. So what happens is that there is an injury that occurs to the head, to the skull, and then there's a sudden movement of the brain inside of the skull. So when I was doing trauma as a resident, for example, we'd see kids that would come in that, you know, hadn't been knocked out, didn't have skull fractures, but would have CAT scans and show significant brain injury. And I think that's the important point that they were trying to drive home with this recent ruling, is that serious injury can occur to the brain with what seems like a minor traumatic event. And the problem is, Jen, that they haven't had healthcare professionals that have decided when these kids need to be pulled out of a game. It was the coaches and obviously people with not as much medical background. And the problem is that if you get repeated head injuries within a short period of time, you can have permanent devastating brain injury. In some of these studies, up to a third of people can have a permanent brain injury if they've had 2 or 3 more concussions occurring in too short of a space of the time to not allow the brain to rest and recover from the injury.
Right, and you bring up such a good point. There's no one on the sideline saying, hey, pull that kid out, because they want to be the hero, right? They want to say, oh, I'm fine, and then they go in. I want to bring your attention to something I thought was really interesting, Dr. Chaffoo, and that is the ruling basically said no headers for kids under the age of 11 in practice or in the game. But then they said those kids that are 11 to 14, 11 to 13, can still do the headers, but only in the game. As a parent, now granted my daughter's still very little and not in sports, but if I had a 12 or 13-year-old, I still think that's pretty young. Why the differentiation?
And I feel the same way. I mean, I've got a bunch of kids as well, and certainly I've got 13-year-old daughters that play a lot of sports. I certainly wouldn't want that either, because the problem is, you know, we've still got a growing brain, and the problem is that with these injuries that occur, these headers especially, we know that the brain in a child, whether they're 10 or 12 or 13 or 15, is developing, and it's very prone to an injury just from the fact that the brain hits against the skull. So I think that the ruling was could have been a little bit stricter. Maybe this was sort of a compromise.
And before we let you go, Dr. Chaffoo, do you think this is paving the way for other sports? We've seen it with the head of soccer. Do we think other Pop Warner football, other sports that kids play in that are sort of head-to-head, if you will follow suit? Well,
Jen, I certainly hope so. I mean, certainly traumatic brain injuries and concussions can occur in any contact sport that we can think of. It's not just from injury from a ball, but from head-to-head injuries or head-to-foot injuries, or a fall from a standing position to a position where a child falls against the ground. It's like getting hit in the head with a hammer. Your whole weight goes against that part of your body. So certainly I think we need to look very carefully at any of the contact sports and reevaluate what we're doing for children and the long-term sequelae of just ignoring and not dealing with as a significant health issue.
Yeah, well, and I guess the positive thing is even 15, 20 years ago, we weren't even talking about concussions with kids or adults. Dr. Chaffoo, always great to have you on the show. Thanks.
Thanks, Jen.